New Mexico Cancer Center and Health Specialists of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
Bladder cancer is one of the most common cancers in men. We know that some of the risk factors are smoking, so half of the diagnoses are in patients who smoke. Age is a risk factor, so patients over the age of 55 are at greater risk. And anybody that's worked with chemicals, workplace chemicals, puts you at higher risk. The important thing to remember about bladder cancer is that when it's caught early, it's very treatable. So blood in the urine is always going to be a big red flag, but there's other symptoms like discomfort in the pelvis, frequency with urination, pain with urination. All these things could be a sign that there's something wrong and that they need to be evaluated. So anytime you have these symptoms, it's important to get into your doctor to get it evaluated. Blood in the urine is never normal, and we should always treat it as something that needs to be looked further into because it's a sign that there's something disrupted within the urinary tract, whether it's an infection, a kidney stone, potentially a bladder cancer. You never want to ignore it. So anytime you have blood in the urine, it's something that you should be seen by your doctor immediately. So the treatment for bladder cancer has really had a marked revolution over the last few years. Now we're dealing with immunotherapies, drugs that turn on the immune system so that the immune system fights the cancer. We have drugs that are antibodies that target the cancer almost like heat-seeking missiles. And when you combine those two approaches, we're starting to introduce it earlier in treatment and we're starting to see better cure rates and better overall outcomes. Developing healthy habits is going to be very important. So we talked about smoking being a big risk factor. So quitting smoking is going to be very important. Staying well hydrated. If you work in a workplace where there are chemicals, trying to take the appropriate precautions, and then being established with the doctor is going to be key so that if there is a problem, you get it addressed early, you get symptoms addressed early, and we know that that's going to lead to better outcomes.